So this is Tara, and she's currently working as a nurse in the UT Health Northeast Cystic Fibrosis Clinic. She joined the CF team in June of 2015 and has been employed with UT Health Northeast since August of 2014. She graduated from the University of Arkansas at Monticello in 2001 with her Bachelor of Science in Nursing, and she has functioned as a nurse in many clinical areas. Tara Sadler.
Is this on? Now it's on. It's going to be so hard to follow you, Kelly. I'm still sniffling from crying so much, which I'm sure everybody is. Y'all probably might have wanted to take a break before I spoke because mine's just a little bit long because I'm talking about infection control. And as most of you know, it's very lengthy, but I'll try to make it quick because the food looks really good outside. So what I'm talking about today is infection control in the CF patient. And for those of you that aren't healthcare providers, what infection control is basically what it says it is. It's to prevent the transmission of disease or to control and prevent infection. And I'm going to kind of go over the who, the what, the where, the why, and how we do all this and try to keep it short and sweet so you can eat. This is a good place to follow Holly because everything we get is from this website as far as how to take care of a CF patient. It's from the foundation. It's how to take care of a CF patient, how to in the infection control guidelines. It's great for parents. It's great for the patient. We also use it. We actually have clinical guidelines, so it tells the doctor, okay, this is kind of how you're supposed to take care of a CF patient according to the foundation. And their infection control guidelines are very lengthy. They're like a 60-page document. And there's tons of stuff in there. If you ever want to go there and look at it, I think it's actually under the clinician side of it, or healthcare provider. I'm not sure exactly what that one is. I think it's patient, caregiver, and clinician, I think is what it is. But according to the guidelines, why is infection control so important for the CF patient? And this is quoted straight from the website. These guidelines on infection prevention and control for CF provides recommendations for people with CF, their families, and healthcare providers to help reduce the spread of germs in the clinic and in the hospital setting, as well as everyday life. So why is that so important for the CF patient? Number one, we don't want them to get any more germs than they have to because there's already a lot of mucus that's in the lungs. It's a perfect breeding ground for bacteria, so we definitely don't want them to get any more germs than they have to. But you'll hear some people talk about the germ spreading cycle and why we don't want, when germs, let me start from here. When germs are introduced, the body produces white blood cells. When the white blood cells they are there to help fight off germs. This is what everybody does, not just the CF patient. But when white blood cells are produced, it causes inflammation. The inflammation is the booger bear with the CF patients because over time, after they have infections and they get inflammation, the inflammation can cause lung damage, and that's what we're trying to avoid. So if they have multiple infections over time, they have multiple inflammation over time. So over that period of time, the lung function decreased, and then they may eventually need a lung transplant. I got to remember to do my PowerPoint over here. So how do we do this? I'm just going to go over a few guidelines that have to do with the outpatient setting, which kind of bleeds over into the inpatient setting, and also with community activities, so CF patients will know kind of what they're supposed to do when they have community activities or functions in their everyday life. We assume all CF patients have germs that can be spread to other CF patients, so we follow what we call contact precautions for all patients, despite if they're a newborn coming in or if they're an 80-year-old patient coming in. We treat all of them the same. The CF Foundation describes contact isolation as to wear a gown and gloves when caring for a patient with CF in either outpatient or inpatient setting. We, as healthcare providers, do not wear a mask routinely, only in situations where we're going to be exposed to respiratory secretions, or if we're sick, we might wear one to protect the patient from what we have. Sometimes we want the CF patient to wear a mask, but not because of their CF. We do this more if they're on some other kind of precaution, like some kind of droplet precaution for something that's not CF related. We expect CF patients to be at least 6 feet apart from each other at all times. And for those of you that have been in our clinic, our waiting room is not 6 feet long, nor is it 6 feet wide. So when we're busy, we rush you usually through to get to either to our triage room, or we take you straight back to a room, or we might ask you to sit outside because of the 6 feet rule. That's kind of why we do that. This, on the other hand, the 6 feet rule does not apply to members of the same household that both have CF, like if they're siblings. And I'm going to kind of talk about that a little bit later on. And I wanted to bring up one point that sometimes we forget about the 6 feet rule in the elevator, because the elevator is usually not 6 feet, or the ones in our hospital aren't 6 feet. So if you happen to see another patient or another person on the elevator, I would suggest you just maybe catch the next ride to kind of keep in that 6 feet rule. Just say, oh, okay, I'll just get on the next one, going up. And that's just really, we're talking about when you're in the hospital. You can't necessarily abide by this rule when you're other places, because the hospital is where you're going to run into other CF patients. We will ask that the CF patients wear a mask to all their appointments, not just your appointments in the CF clinic, but all your appointments, your research appointments. If you have an appointment with your primary in another part of the hospital, all your appointments. I'm reading my notes. Y'all bear with me just a minute because I have a lot of them. We ask that you put your mask on before you ever really get out of your vehicle. There's lots of reasons behind that. I've heard people speak at a big conference we go to, and they say that when they're doing construction, and almost all hospitals are always doing some type of construction, they want you to put that mask on sometimes 30 minutes before you get to the hospital. It's because it puts them at risk for aspergillus, which is a type of fungus that is real common in CF patients, because it releases when they do construction. We just kind of ask that you put it on before you ever get out of your vehicle here, and it's just to protect you. It really, if you don't put it on when you get out of your vehicle, please put it on before you get in the hospital. You should wear your mask while you're in the waiting room, while you're in the triage room, you're in the hallway in the clinic or in the hospital, or you're in the restroom. You may take off your mask when you're in your clinic room, or when you're in your hospital room. But anytime you're outside of that, you need to have your mask on. And somebody already asked, are you going to fuss at Kelly for not having a mask on? I said no, because she's the only CF patient here today. So, yeah. I said, are you going to fuss at her? I said, no, I wouldn't fuss at her. We asked, like, if for some reason sometimes you come to the clinic room and we send you out to go get x-ray, we want you to put your mask on if you're going to get an x-ray, or go do your spirometry. But of course, you can't wear it when you do your spirometry because you're doing all that blowing. I'm going to talk about respiratory hygiene in just a second. Masks, when they're wet, they're no good. So if you're coughing a lot or you're sick, your mask needs to be changed. We have plenty of masks. I will gladly give you some if you need some. But it needs to be changed when it's wet. If for some reason a patient cannot wear a mask because they're, say, in respiratory distress, sometimes when they're short of breath, it really just feels like you're suffocating when you put a mask on. We won't push the issue, but we'll just ask you to practice kind of respiratory hygiene, and I know y'all have all seen that, and it's where you cough here like that, or if you use a tissue, you cough in your tissue, and then you throw it away, and then you wash your hands. Because we're not going to push it if you already feel like you can't breathe. And of course, you can't talk about infection control without talking about our good old friend, hand washing. It is the single most important thing you can do, not only as a healthcare provider, but as a patient, a parent, a caregiver, to prevent the spread of germs. The CF Foundation it's okay to use alcohol-based hand rub. I've been asked that a couple times. They say, yes, please do. Or you can do the regular hand washing that we're all used to. The foundation gives recommendations as far as when to wash your hands, like the standard Centers for Disease Control, the CDC guidelines, like before and after your patient contact, before you enter your room, et cetera, et cetera. We recommend that patients and family also wash their hands when they enter the clinic. When you come in our clinic, we have something you can push on the wall, or we have a hand pump there Then after you go into your clinic room, we ask that you wash your hands. And then if you have to leave and go do testing and come back, we want you to wash your hands. And then we want you to wash your hands when we leave. And that's all for protection of you, so you're not picking up germs from another CF patient, which I'm going to talk about our environmental practices in just a minute. And of course, after you cough or sneeze, that would be great. And I want to give just an idea about, this kind of leads into my next slide about environmental practices, but I want to kind of bring up a point about germs for those that aren't real familiar with how germs work, of an example of what we do that some other people might not think about. When our adult CF patients come into the clinic, we give them a clipboard with paperwork on it and a pen. And they fill out this paperwork and then they hand it back to us. A lot of people don't realize we disinfect that, pen included, before we put it back where it belongs, so the next CF patient won't touch that clipboard that the other CF patient just touched, and they just share germs. So that's an example kind of environmental practices or housekeeping, however you want to look at it. This is kind of what goes on behind the curtain, so to speak, that some people don't see that we do, and why sometimes we don't have a quick clinic. And we have to clean the exam rooms every single time, not just for our CF patients, but every single patient that comes in our clinic, whether they're newborn or whether they're older, we disinfect that room. And it's all for protection of the CF patient. We use a hospital recommended, they call them Santa Claus, and we spray with like a hospital grade Lysol. We clean all horizontal surfaces and then some. And then we have to wait 30 minutes before we put another CF patient in that room for infection control, so they won't share germs. Now, you might see us put another patient in that room, but they're not a CF patient, because I've been asked that, like when we do our pediatric clinic. Some of the mothers have said, well, why do y'all have all these kids running around? Well, they're not CF kids, because we don't let our CF kids, we keep the 6 feet rule. They may be coming for something else. The spirometry or the PFT room, they use HEPA filtration, and when you use HEPA filtration, you still have to disinfect the room, but you don't have to wait that 30-minute layover time. And one day, hopefully, we might get those. And I wanted to bring up, too, about healthcare providers, because they forget to clean their stethoscopes. And that stethoscope, just listen to this patient, please disinfect it before you touch the next patient. That goes for all people that carry a stethoscope. As far as community activities, CF patients should avoid activities with all other CF patients, period. No in-person social contact, no physical contact like handshakes or kissing or like any kind of intimate contact, no car rides, no sharing hotel rooms, and no fitness class. Now, back to living in the same household, and this is where it gets kind of confusing. If you have CF patients that live in the same household, like usually it's siblings is what we see. This does not apply. You can, like, let's just say Kelly had a sister. Kelly, I hope it's okay to use you as an example. Kelly's sister could be here today because they've grown up in the same household. So they're kind of used to each other's germs, so to speak. Now, they do recommend, the foundation recommends that the CF patients that do live in the same household, they don't drink after each other. They don't share dental equipment, which I hope they don't do that anyway. And they don't share respiratory equipment. Respiratory equipment meaning the vest that they use to help with airway clearance, for those of you that don't know what that is, and also like their nebulizers and stuff. That should not be shared. It should not be done in the same room either, because you're coughing when you do that. So usually, if the say sibling A does their airway clearance in a communal area like your living room, the CF patient B should not be in that room. I have siblings I know that one keeps theirs and their stuff in their room, and the other keeps theirs in their room, and that's where they do their airway clearance, and they don't do it in a communal area like the living room. The foundation does say, kind of switching gears a little bit, the foundation does say that you can drink and bathe in regular tap water as long as it passes local public health standards, and that you can drink bottled water and drink distilled water. Now, as far as attending community activities related to CF, this kind of gets into today. For instance, when you have an indoor activity that's related to CF, you can only have one CF patient here. Unless, of course, you live in the same household, then you can have the two that live in the same household. We have asthma camp here that is put on by the hospital, It's not put on here, but it's put on, represented by the hospital. We usually have a CF patient that goes to that, but it's only one CF patient. So a CF patient can go to camp. They just can't go to camp with other CF patients unless they live in the same household, like if it's a brother or sister or sibling or something. CF patients, and then I want to go back to that about, because I have the great strides up there about the walk. CF patients can go to the walk because it's an outdoor activity. So you will see multiple CF patients there, but you should not see multiple CF patients in an indoor activity. CF patients can attend the same school or daycare, but they don't want you in the same room at the same time unless they live in the same household. The daycare and the school personnel should be educated regarding these guidelines about infection control. And if you need help with that, please let us know. We have a team here. There's multiple ones of us that can go and speak to the school nurse if we need to. Well, Kendra already does a great job of letting the school know already all the things that go on with the CF patient since they need extra TLC. So she already takes care of that, but any of us can go and talk to them if we need to. I wanted to bring this up because I thought it was a good point. The CF Foundation says you are not obligated to disclose the diagnosis about your CF, nor are you you do not have to disclose sputum results either. However, they recommend you do this for protection of the child. So the school and so the personnel can be educated regarding infection control. I'm almost done because I know you're hungry. The CF Foundation, they recommend that you limit activities where there's prolonged exposure to dust, like gardening and lawn mowing, and if you must, please wear a mask. Please wear a mask. They ask you avoid any kind of construction or renovation activities. If you just must, please wear a mask. You can swim in pools. You can attend a water park. They tell you to avoid hot tubs, whirlpools, and as far as the stagnant water, at this point in time, the foundation does not have sufficient evidence to recommend for or against people with CF to like swimming in the ocean or swimming in the lake, or they even say hot springs, and I'm quoting that word for word. In other words, they don't tell you to do it, they don't tell you not to do it. Either way, because I've been asked that before, if they could swim in the lake is the big question I get. And just to add a little excitement to my PowerPoint, I put this crazy animal in my PowerPoint because we're talking about animals. I have no idea what that is. It's the beauty of the internet there, if you can even see it. As far as animals, they tell you, yes, you can own animals if you want a dog or a cat, but they ask you to please perform hand hygiene after changing like litter, or if you clean up after them, if you disinfect fish tanks or cages, or if you interact with any kind of farm animals, wash your hands, wash your hands, wash your hands. Do avoid cleaning stalls, pens, or coops. And I've been asked this before, can they participate in pet therapy? Our hospital has this wonderful program where they bring in dogs certain times, and they can go in and interact with the patients, which I think is wonderful because our CF patients have such long hospital stays, so it kind of breaks it up. You can pet the dog, just wash your hands afterwards. Enjoy it, because they're really sweet dogs. The foundation wants the public to be aware of these guidelines for a lot of reasons. One of the reasons is there's kind of a stigma that goes around with them, and some people are scared of the person that wears the mask, which I think is crazy. But the reason they have these guidelines are not to protect us, it's to protect them because they're so prone to infection. They also recommend making accommodations to them to relieve the stress of inpatient and outpatient infection control guidelines because it's very isolating. We want them to stay in a room, and you're usually hospitalized for like 14 days at a time. You're going to go insane. So thank God we have social media. That probably the only time you'll ever hear me thank God over social media, but for that fact, it's great because we have FaceTime, we have Skype, so they can actually interact with other people and they don't feel like they're just by themselves. We also here at the hospital try to do things when they're inpatient. We provide them a really big room. We provide TVs, fridges. Hopefully one day we can get microwaves. I talked about that with Dr. Couch today. So they can at least try to make the best of it, if you can even say that for staying in the hospital that long. I do want to bring up a point when we talk about the stress of this. We don't provide toys in the clinic for like our kiddos that come in because of infection control, but we ask the parents to please bring toys for them because our clinic visits are really long because they don't just see the doctor, they see all of our team. Some parents, I think, have a really good idea because they have special toys that they only get to use when the child's hospitalized or when they go to the clinic. So they kind of look forward to playing with the toys. So I think that's a really good idea for the kids. And then the last thing I wanted to talk about was why, kind of tie all this in. The CF community is continually challenged by the changing epidemiology of the CF pathogens or germs. In other words, there's always something changing with CF. It's constant change, which is a good thing because they're trying to find a cure. That's the ultimate goal. One way that they keep up with this, I wanted to kind of talk about what we call the registry, but it's the CF registry, cystic fibrosis registry. We ask y'all a lot of questions about this so we can input this data in the registry. Of course, we have to obtain consent before we do that first. And we put in everything from sputum results to their height, to their weight, every clinic visit, every hospital stay, dietary information, airway clearance, if you're on supplements, your lab results. And then we input all this in the registry, and this is what the foundation kind of uses. One thing that they use, one item that they use to kind of collect information to help treat the patient come up with new research and how we take care of them for the ultimate goal of the cure. And I'm about done. I'm done. Do y'all have any